Hi everyone, my name is Rosie Perkins and I'm one of the co-applicants on the Loneliness and Social Isolation in Mental Health Research Network. I work at the Royal College of Music and I have an honorary position at the Faculty of Medicine at Imperial College. My job title is Professor of Music, Health and Social Science, so you can get a sense of the different disciplines that I work in. I think of my work as both multidisciplinary and interdisciplinary. So I've been asked today to think about three questions. The first is what drew me to working in mental health research. And I think the honest response is quite a number of things at the intersection of my professional and personal lives. But my academic journey started with researching how musicians learn in conservatoires of music. And from that, I learned that music students benefit from opportunities to think about music and their role as musicians in society really broadly during the time they're in higher education. So in turn, this led me to running a number of projects, bringing together musicians with different groups of people, including people experiencing mental illness. And my research now investigates what this means for mental health, both for participants and for musicians. The second question is the biggest challenge of working in a multidisciplinary way. And before I go there, I'd like to add that for me, the advantages and the possibilities far outweigh the challenges. I've learned a huge amount about things such as language and methodology from listening to colleagues from other disciplines. I think personally the biggest challenge is navigating a bit of a sense of imposter syndrome, that feeling that I'm sort of on the edge of different disciplines, because I don't necessarily fit neatly into how music might be seen as a discipline. I'm not a performing musician, for example, or how mental health might be seen as a discipline. I'm not a psychiatrist or a psychologist. And there have been times as well where I felt I've had to defend a little bit the idea that music can be robustly investigated and implemented as part of mental health care. But most of the time, I'm very happy here in this boundary crossing space. Finally, my top tips for multidisciplinary working. First is definitely a genuine open-mindedness, being open to the expertise that people from different disciplines bring and how this can be harnessed to address different research questions in ways that might be different from what we know and we're comfortable with. And second, a willingness to reflect critically on practices and assumptions within our own disciplines, recognizing their limits and looking inwards as well as outwards. And finally, being okay with taking a few risks, chatting to new people, sending someone from a different discipline an email to see if they want to connect, entering new spaces and places. In our Loneliness and Social Isolation network, we've done this and we've had a fabulous time. I'm sorry I'm not there in person today, but please do feel free to connect. I'm at rosie.perkins@rcm.ac.uk. Thank you so much.